Hello, and welcome to a Health Podyssey. I'm your host, Rob Lott. Friends, it's good to be here with you again. And this week, it's time for another one of those very special episodes where we get to break the rules a little bit and invite someone who, even if they haven't, like most of our guests, just published a new research article in the pages of Health Affairs, they do have some authentic and deep insight into the state of the health policy universe today. We're always so lucky to hear those perspectives and to learn from our guests' experiences. And today we'll be learning from the one and only Dr. Uché Blackstock. Dr. Blackstock is a physician and former associate professor in the Department of Emergency Medicine at NYU School of Medicine, where she was also faculty director for recruitment, retention, and inclusion in the Office of Diversity Affairs. She's the founder and CEO of an organization called Advancing Health Equity, which we'll hear about in just a moment. And she's an author. Her book, titled Legacy, A Black Physician Reckons with Racism in Medicine, has been described as a generational memoir. It was published last year and was just recently released in paperback by Viking Books. Dr. Blackstock, welcome to A Health Podyssey.
Thank you so much for having me. I'm also going to mention that Legacy was an instant New York Times bestseller, which I think speaks to really the importance of the themes that the book covers.
Oh, wonderful. Well, I can't wait to hear a little more about your journey writing that book and what it's been like talking to readers over the last year. But first, maybe we can start with the organization that you founded. I just mentioned Advancing Health Equity, which describes its mission as, quote, partnering with organizations on their journey to eliminate bias and discrimination in healthcare. Can you tell us a little bit about what that looks like in practice? What's your day-to-day work? What kind of organizations are you partnering with?
Yeah, so I always call Advancing Health Equity my third baby. I have two kids, and I birthed this organization about 6 years ago, really because I wanted to do work with health and health-adjacent organizations in a way that was very authentic to me. And so through several services like trainings, assessments, and strategic counsel, we help, as you mentioned, a variety of organizations on their health equity journey. So we work with nonprofits, we work with hospitals and health systems, departments of health. We also work with pharmaceutical companies, and even some non-health related organizations that want to kind of learn more about what they can do in health equity space, since we know that health is not just about healthcare, right? So we've really been able to do some wonderful, wonderful work. For example, we did a department-wide training with the New York State Department of Health over the last few years, and our recommendations to them after the training and assessment influenced them to create health equity as their pillar, one of the pillars for the Department of Health.
Okay, great. So that's a great example, and I'm wondering if you can sort of expand on that a little bit. To what extent is this kind of work focused internally with your partners, sort of looking at things like organizational policy and practices, hiring, training, that kind of thing, versus more external focus, like changing culture and societal structures? Is that even a useful distinction? How do you kind of look at those tensions?
Absolutely, because I feel like a lot of the work we do is both internal and external facing. So we know that how organizations function, and what organizational culture is can influence like the work that is being done, even if the mission of the organization is one that, is in alignment with our own. We know that there are a lot of organizations that, want to do the good work, but maybe don't know how to do it well in a culture way. But I think the other piece that is really important is thinking about how organizations engage with communities and patients. And so we also do those assessments, and these assessments with communities, focus groups with patients. And we also look at policies. So we do what we call equity audits. So we look at organizations and institutional policies. We also look at policies involved with how these organizations interact with community members as well. So in my opinion, the work is incredibly synergistic. You cannot do the internal facing work without doing the external facing work.
So you founded the organization in 2019, I think. And we know there have been some pretty big external shocks since then. COVID-19, the George Floyd murder. These things have really shaped the health equity space in that time. But also, I'm sure maybe you've encountered some surprises and unexpected realizations over the course of your work leading an organization like this. Can you tell us about some of those surprises you may have encountered?
Yeah, I think for a lot of organizations, 2020 was that turning point for them and thinking about health equity and all the factors that cause racial health inequities and what they can do about it. I think in the beginning, a lot of it was just sort of like level setting. Organizations just wanted to. There was a lot of requests for trainings and just spaces where people can have like courageous conversations about these really what to some people are uncomfortable but important issues. And then we noticed over the last few years that they've really been asking more for assessments, like organizational assessments, program assessments, and we develop strategic reports and recommendations and strategies. And then now, more so, we're looking at more longer-term engagements. So these engagements are engagements where we are counseling them on how do you integrate health equity into your strategic plan so that it's something that is not necessarily in a silo, but it's something that everyone in every role within the organization is thinking about and that you have really clear goals for, the next 3 to 5 years.
All right, let's talk a little bit about your book, the title of which is Legacy, which I understand is a reference to maybe at least two things. One is the legacy of racism in American healthcare, stretching back centuries and really impossible to avoid today. But another is your mother's legacy. She went to Harvard Medical School, then so did you and your sister, making you all Harvard's first mother-daughter legacy graduates. And in your book, you write about how in the 80s and 90s, as you were growing up, she served as the attending physician in a public hospital in Brooklyn, the same neighborhood where she grew up. And you write about how she knew the community and the people she served intimately and practiced what we might today call whole person care. And so in her own day-to-day practice of medicine, she too was advancing the cause of health equity. Is that a fair way to sort of describe perhaps the sort of foundation of her legacy?
Yeah, no, absolutely. And I think what's even more profound is that, my mother grew up in the same neighborhood in central Brooklyn where she practiced. And unlike me, she had a very different set of circumstances growing up. She grew up in poverty, on public assistance, first person in her family to graduate from college. And then through luck, fortune, and hard work, ended up at Harvard Medical School, and really could have gone anywhere after Harvard Medical School. We know that most of the Harvard Medical School graduates go to some Ivy League affiliated institution for their residency and then stay there. But my mother, what was really important for her was to come back to her community. And so she came back to New York City, trained here, and then worked for many years in the same neighborhood that she grew up in. And I think what is so important about that is that I think she had a really deep understanding of where her patients were coming from, and this understanding that we know health is not just about healthcare, it's about what's happening, on a community level. And I think she and some other, Black women physicians in our neighborhood, they had an organization where they would hold community health fairs and they would make sure folks had access to housing advocacy groups and groups that were doing work around food insecurity. So they were really thinking about like what health equity looks like before that expression was even coined.
Sadly, I know she died in 1997 when you and your sister were 19. And as someone myself who's also lost a parent in early adulthood, I can attest to my own experience, at least, that there's always something painful, but also maybe bittersweet too, in a way, when I think about everything they've missed since their passing. Achievements and disappointments, grandchildren's milestones and big world headlines, all the stuff, we didn't get to share with them. And obviously, since you lost your mother, a lot has happened in your life, but also a lot has happened in health equity, as you said, and in our efforts as a society to confront racism in healthcare. An effort which she obviously was a part. What do you think your mother would make of the state of health equity in America today?
It's interesting because in Legacy, I was able to include some of my mother's own writing from an essay that she wrote in the mid 1990s, and in that essay, she talks about being a Black woman in medicine, but she also talks about the health disparities that she sees. And so, thinking that so many years, decades later, even though a lot of really wonderful work has been done, and we've seen some improvements. However, we still see very profound racial health inequities in this country. We actually see like all Americans not doing well when we look at, indicators of well-being like life expectancy and maternal mortality. So that's for all racial demographic groups. But then when you look for people of color, Indigenous and Black people, it's even more profound. So I think my mother would be sadly disappointed that despite advances in research, innovation, and technology, that we really haven't profoundly closed that gap.
How would you describe the changes we've seen, if we have seen changes in the space over the last 5 years since you founded this organization, but maybe to put a finer point on it, over the last 5 months?
Yeah, I think I would say 5 years ago, I felt so incredibly hopeful because, I founded Advancing Health Equity in 2019. It was before the pandemic. Before George Floyd, I saw a need really to work with organizations on their health equity journey, right? And so then when COVID happened, even though it was obviously horrible, George Floyd horrible, but it kind of just validated like all of like the work that I thought was important to do. And it felt reassuring to see organizations dig deeper into that, doing that work. And actually operationalizing what health equity looks like integrating it into their strategic plans, right? Like looking at what kind of data is collected, right? And then also thinking about health equity in terms of like quality improvement. Because when I think about health equity, I think about you want quality health outcomes for everybody, right? Isn't that what everyone, not only in healthcare, but in this country wants, right? Sure. Like that's what you should want. So, I think that, last few years, I have to say that there were times when I could not even keep up with the client inquiries into the work that we were doing. However, that has totally shifted, especially in the last 5 months. I can personally say we had clients that are academic institutions that have canceled contracts with us because they are worried about being penalized by the federal government for doing health equity /DEI work. We've had delayed payments from organizations, from federal agencies as they try to, think about what's happening and as funds are frozen. And so I have to say it's devastating to see this happening. I feel like there are similarities in some ways to 2020 to now, and that in terms of a lot of uncertainty. But what I always thought then, and I still think now, is that I still have to stay in alignment in terms of the work that is important to do. And, I think that there still are organizations out there that want to do the work, and then also kind of maybe reframing how we speak about the work, but the mission and the goals are still the same.
Fair enough. I want to hear a little more about how you're putting that mission into action. But first, let's take a quick break. And we're back. I'm here talking with Dr. Uché Blackstock. We've talked about some of the recent changes we've seen in the health equity space over the last few years and the last few months. Going back a few years, Dr. Blackstock, I know you held prominent roles in academia, associate professor, faculty director, big positions. But eventually you decided to step away from that. And in early 2020, you published an article in Stats titled, "Why Black Doctors Like Me Are Leaving Faculty Positions in Academic Medical Centers." Can you tell us a little bit about how you made the decision to leave academia and some of the factors that may have contributed to that decision?
Yeah, sure. So I was in a department of emergency medicine, at a very, well-known academic medical center. And, even though it's one of the largest departments of emergency medicine in New York City, and even though it's in the middle of New York City, one of the most diverse cities in the country, it actually wasn't that diverse for a long time. For most of the time I was there as either the only Black faculty or one of two Black faculty. So there just didn't really seem to be an awareness of the importance of, increasing diversity among faculty. But it really was, I did a lot of medical education work, which I really enjoyed. But about 7 years in, I was appointed to a DEI role in our school's Office of Diversity Affairs. Super excited about it, tasked with focusing on recruitment and retention of women faculty and faculty of color, as well as students and trainees. And unfortunately, in that role, it was just a figurehead role. So it was very demoralizing when I found that out, that I wasn't actually going to be empowered to do something in that role. And so I started thinking about is this the environment that I really want to be in, where I can't do work authentically and show up as my full self? And so I made this decision. I know it sounds absolutely bold. And so I decided to, found my company, Advancing Health Equity, so I could do the work the way that I wanted to do it. And then I thought maybe I'd stay part-time in academia, but then it became really clear that I wanted to leave. I just wanted to kind of be free of these really these institutions that I think, to be honest with you, I write about this in the stat piece, they weren't even created with Black faculty in mind. At the times they were created to exclude us. And so I feel like the remnants of that are still there.
Fair enough. I mean, perhaps with some distance now, you've been out for a few years. How would you describe what's working and what's broken? You've just sort of alluded to that here about academic medicine more generally.
Yeah, I mean, and interesting, to answer that question now, because I feel like, academic institutions, higher ed institutions are, under more pressure, right? I just found out about this. I don't know if it's some proposal saying that medical schools, they can't use there's a accrediting body called the LCME that requires that medical schools have diversity initiatives. They just I had to get rid of that, So I feel like we're going backwards, and I'm wondering, how can we still do the work that's important, right, but under these very restrictive environments?
So I guess in that context, I want to shift gears a little bit and sort of think about one of the starkest illustrations of how far we still have to go when it comes to health equity. One example is the really shockingly persistent disparities in Black maternal mortality. And so, here at Health Affairs, a policy publication, so often when assessing commentaries and perspectives, our editors look for pieces that describe a convincing mechanism or pathway that connects a given policy or lack of policy, perhaps, to various downstream health impacts. And so when we think about Black maternal mortality, that crisis, I'm wondering if you can share some thoughts about what policies, perhaps, what interventions or obstacles are translating to such devastating mortality rates among Black women.
And I always use this statistic that even myself as a Black woman with Harvard College and medical school degree, I still am 5 times more likely than a white woman with an 8th grade education to die of maternal complications. Right. So this is something that is not protective by your profession or socioeconomic status. And I think that when we think about the policies that would address this, it has to be policies that, are multifaceted policies. So, obviously thinking about what the perinatal workforce looks like and working on efforts to diversify that, looking at how the social determinants of health in Black communities, how that impacts health, looking at, for example, even the climate crisis and how we know that Black neighborhoods, because of the legacy of redlining, they are essentially like these urban heat islands. And we know that actually is implicated in preterm deliveries. And so those are just obviously some policies I think are important. The other one that I think is so important is thinking about, a lot of the deaths that happen around birthing happen in the postpartum period. And a lot of it is because in this country, we don't have a mechanism or system in place to really care for people in that postpartum period. Most people will either just have 1 or 2 visits with their OBGYN, and that's it. And we know the Commonwealth Fund, this is such wonderful health policy work. They talk a lot about, and they've shown this in their data when you compare the U.S. to other high-income countries, that one, because we don't have midwifery-centered model of care in this country, that leads to more complications, and it doesn't treat the pregnant person as a full, sort of along the spectrum as a whole person. The other issue is that we also need there to be systems in place so that people are followed after they give birth, followed very closely, because people go home, they develop high blood pressure, there's no one taking their readings, and then they develop preeclampsia or they're hemorrhaging out. No one is going there to take care of them. And I think paid family leave, paid sick leave, all of these really, I would say, basic policies that a lot of other high-income countries have that we know improves postpartum outcomes could make a real difference.
So it's such a huge challenge, and I know this is one of your focus areas, and I'm wondering if you could say a little bit just about how you keep from being overwhelmed when you face something so big as this, or maybe a more realistic way to ask would be, when you do feel overwhelmed, how do you cope?
Yeah, I think recognizing that this work is all about sustainability and being able to do it in the long term and thinking about the long game. I also try to look for hope, and even in dark times. But I think also what I recommend for myself and other people is really to look hyper local and locally at potential solutions, right? So when everything seems so overwhelming, like I talk about in the book, there's a birthing center in Minneapolis called the Roots Birthing Center that was started by a Black midwife. The mission was to provide dignified and respectful care to Black birthing people. And they've actually shown by this model that they have improving maternal complications and preterm deliveries. So there are a lot of really wonderful community-based organizations very, very close to us doing a lot of this wonderful work. So we have to think about how we can amplify their work. How can we help fund their work? How can we engage with them? So that's kind of what gives me hope during these challenging times.
Well, that's a nice way to think about it. I appreciate that. Before we wrap up, one question we often ask on this podcast is to ask folks to imagine if they could snap their fingers or make a member of Congress or governor or city councilor sort of take your advice, no matter what you say or sort of however you imagine it. If you could change one public policy in order to make American healthcare more just and equitable, where would you start?
Single payer universal health care.
Okay.
I'm a big supporter. I know that we have the data that shows that this country, we spend so much on administrative costs. We're incredibly inefficient and we have the worst health outcomes. And while I don't think single payer universal health care will solve everything, I think it would make a significant dent in how people fare in life.
And how do you sort of put that aspiration in the context of, the next few weeks, the next few months, the next year of potential policy changes, if we can sort of acknowledge that we're unlikely to see that, in the near term? What
Yes.
Sort of more immediate changes do you think might move us from here to there?
Yeah, I mean, I also think, well, looking local, I mean, looking local, state, I think there are a lot of really wonderful examples of localities and states sort of doing this work around making sure that, like Massachusetts, making sure that people have health insurance, obviously supporting Medicaid expansions, even though we know that that's, up for being cut as well. But I think the advocacy piece is really, really important. So I am always contacting my legislators. There are a lot of really great apps. I think one is called 5Calls, where you can just put in your name, your zip code, and they'll send a letter or voicemail to your legislators about these issues that mean a lot to you.
Wonderful. Well, great advice and a good spot to wrap up. Dr. Uché Blackstock, thank you so much for taking the time to speak with us today.
Thank you for having me. I forgot to mention I'm a huge fan of health affairs. Even though I'm no longer in academia, I love and look forward to the issues and reading all the really wonderful articles that you publish. So thank you for your work.
Well, wonderful. Thank you. And of course, we're always eager to receive submissions and would love to perhaps see some pieces from you along the way, perhaps building on your book. Here's my segue. Legacy, A Black Physician Reckons with Racism in Medicine, New York Times bestseller, generational memoir, available at bookstores now. And to our listeners, thank you all for tuning in. If you enjoyed this episode, recommend it to a friend, subscribe, and tune in next week. Again, Dr. Blackstock, thanks for your time.
Thank you so much.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about the Health Podyssey.